Hi, I'm Joe Ketcherside, and thanks for the opportunity to talk just a little bit. And what I'm going to do is first welcome all of you to Kansas City. This is also my home. It's great to see a lot of you that I communicate with and read what you say. For all we're talking about the value of silicone, I still think carbon-based life forms have a role in our world today. So it's great to see you all and talk to you. I also have a number of members of my team that are here, Ross and Colby and Linda. Andy's helping us some. There's a few others that couldn't make it, but we're very interested. I'm going to very quickly tell you about why I'm doing this and what this is. And as Regina mentioned, or somebody mentioned, later today, I've got a little bit longer session where I'm going to talk about technology from the patient standpoint. This is my jacket that Regina painted to tell my story of my experience. My co-founder and I in Pocket Health each have over 30 years experience, and actually I was just thinking it's almost 40 now in healthcare and health IT. He's a pharmacist, I'm a physician, but for the last 15 years we've been building enterprise level systems to combine hospitals, offices, e-prescribing, provide decision support. We were building this monster of systems that still left a gap. Patients couldn't connect. Patients couldn't get their information. And we realized that this really was healthcare's last mile, just like in telecom, where you have to connect to people. The best network in the world doesn't do any good if the people that matter aren't connected. And so we decided we were going to create something that we call Pocket Health. And Pocket Health is a tool that connects you into all the rest of those areas of information and puts you at the center, because it's really all about the patient. So how are we different? Well, the tool we built is different first because of ownership. It's a locally stored database. It's not stored by your doctor. It's not stored by the Google or anybody else. This is something where you manage the data, you control the data, you decide where you share the data, because privacy and security are so important. At the same time, data standards is the other difference. If you can't communicate your data between providers, then it's meaningless. I mean, figuratively and literally, it's meaningless. And that's going to be one of the key things that changes over the coming years, is the ability to have data interchange. And I think you're going to probably hear a lot more about that later in some of the other sessions later today. So those are some things that are very different. And it's interesting, as we've started on this project, every place we go to talk to people, they interrupt us and explain to us why either they or somebody in their family needs this. But the sad thing about it is that you wouldn't believe the next thing they all say is, "That is so cool. I'm so glad somebody's doing something like this." And remember I said the 40-year thing. I know that personal health records have been around for 15 or 20 years. Everybody I talk to talks to me like they've never seen one before, and I'm new. So that's the sad part, is we just don't have the knowledge. So a part of our mission is not just to create a powerful interoperable tool, but to actually take that message out and help people understand why they need tools like this. Thanks.